Good day, everybody. I'm Naimish. I'm going to represent my project through this PowerPoint slide. Uh, this project is about the nurse practitioner position in Central Highland Community Mental Health Service in Central Queensland region. First part of the project, first I like to discuss about nurse practitioner. What's the definition of nurse practitioner? A nurse practitioner is a registered nurse, educated and authorized to function autonomously and collaboratively in an advanced and extended clinical role, work independently, can diagnose mental health disease and provide holistic mental health treatment. Also, there is another role of the, then I'd like to discuss about the role of the nurse practitioner. There are quite a few different roles, but I like to concentrate on the comprehensive mental health assessment and a comprehensive biopsychosocial assessment. Another important role of nurse practitioner is that they need to develop the management plan of the client that they see. And also they serve as the patient's primary healthcare provider and can assist clients of all ages with their mental health issues. And also, nurse practitioner's role is the care by nurse practitioner associated with the decreased hospitalization. And also another part is that care cost effective in Medicare beneficiary. Another important role is that provide a high quality, affordable, patient-centered care. The aim of this project to initiate a new project for this region to promote and improve the mental health and well-being of the Central Highland population, to provide accessible, sustainable, reliable, and high quality nurse practitioner, and to become a recognized nurse practitioner in the Central Highland. Because there have been no project has happened in this region before, this is the first time and first opportunity that somebody is going to represent the project for the future nurse practitioner position in that region. This one is the geographical view. You can see the Emerald, that's main hub, 1 hour north Capella, 1 hour south Springshore, 1 hour east Blackwater, and 1 hour to west Willow. But there is one region that I like to concentrate on, Wurbinda. Wurbinda is it's very small town. That's very isolated town as well. It's considered as a rural and remote town. But the main thing is about Wurbinda is that Wurbinda has the highest number of Aboriginal population and also the highest number of suicide rate in Queensland. And people, there are like a high number of people present to the emergency department in Wurbinda Hospital with mental health issues. So this town is very it's a very well known for this mental health issues and the suicidal rate. So that's why it's very important to have nurse practitioner position in the Central Highland region. This one is the Emerald Hospital. This is the main hub, and a possible nurse practitioner is going to work from this hospital. There is a distance and a traveling time. You can see Emerald to Rockhampton. It's 240 kilometer, and Rockhampton has the only acute mental health inpatient unit and the older person's mental health inpatient unit. Another part is that Emerald to Wurbinda, it's 204 kilometer. That's very big, long distance to provide the care to Wurbinda. Emerald, Capella, and Springshore, it's only 1 hour drive. It's very important to know about the demand and supply. Uh, the demand of this mental health service is growing up. People are, there are like the number of presenting to the emergency department has gone up, rapidly, but on the other side, there is a minimal supply of mental health clinician from last more than 14 years. We There are like always be the staff shortage in mental health service, and there is no staff who can prescribe the medication, so they have to depend staff or medical officer working in Rockhampton. So there is no nurse practitioner, in this region at all. The next point is that I like to discuss about the gap in the existing service delivery to the communities of the Central Highland. The first point is that no prescriber for mental health pharmacotherapy, because there is no nurse practitioner or there is no psychiatrist or the medical officer or psychiatrist working in Emerald Central Highland region. All this service they provide from Rockhampton via video link or telehealth or the phone conversation. There is limited access to the authorized mental health prescriber. Infrequent face-to-face reviews, missing out the service and falling between the crack. Reduce mental health service outside of the business hours. Difficulty in attracting and keeping health professional in the region due to the geographical location, because it's people like to live in a close to the coastal area, and Emerald is a 3 hour inland. That's like a 4 hours to the coast. So people doesn't like to live in Emerald. The consultancy with the medical officer mostly via telehealth or phone. Lack of the psychiatrist or the psychiatric register working in this region. Not receiving mental health service in timely manner. Now we like to just glance through the social determinant of health, poverty, unemployment, housing, education, opportunity, hunger, and food instability, access to healthcare, stigma, and discrimination. These are all the correlated social determinant of the health as well, and because of this reason, there is big issues on the mental health service. The model of nurse practitioner delivery system service, face-to-face medical consultation to the individuals with the mental health issues, clinical opinion and the diagnosis of mental disorders, prescribe appropriate mental health pharmacological treatment and access to PBS, clinical leadership outreach clinic to the communities within the Central Highlands, district by face-to-face and telehealth to individuals in smaller towns. Design and implement therapeutic regimens. Initiate referrals to the other health professional. Provide patients rebate for the some service through Medicare. Order and interpret pathological and radiology tests. Now I like to discuss about the suicide. That's a very important part of this business plan as well. The Queensland, that's it's a number three in the ranking in a suicidal rate after Victoria and New South Wales. In suicide rate in 2008, there were like 1,199 deaths in 2015, 32 average number of suicide deaths per year from 2013 to 2015. You can clearly say like Central Queensland has a 3% higher than the Queensland rate. So it definitely shows that the suicide rate in Central Queensland is very high. It may be the natural disaster, unemployment, mining meltdown, and farmers, drought and natural disaster. It's 4% indigenous. That's another part that we need to discuss and we need to consider as well. You can clearly say this is very good table that I received. I got it. But it's a suicide. It does discuss about the suicide rate from 2010 to 2014 and suicidal rate 2008 to 2012. You can clearly say like the Central Highland has 11 11 number, that's the suicidal rate. That comes in the third one in the row after Rockhampton and Glaston. Definitely as per the population wise. Rockhampton has the highest number of population, Glaston is the second one, and Central Highland is the third one. Are the NP's roles and the scope of practice stand by medical officers? It's very important to at least we need to aware about NP's work in one area of expertise only. Like this role is a mental health services. So I will be providing the care in mental health service. So it's only one specialized. I cannot provide the service in a medical area, so that's another part. Nurse practitioners effort within the harsh medical guideline within their area of proficiency. Nurse practitioners exertion of self-sufficiently but in a teamwork with the medical officer. Nurse practitioner can help medical officers provide a service to a greater population by undertaking the oftentimes unbearable process of mental health assessment and introductory inquiries. This is where so we discuss about the aim, the gap, nurse practitioner delivery to the service, and now the expected outcomes. The short-term expected outcome is that improve the access to mental health treatment, regular clinics to the treatment mental health condition, diagnose treatment, and manage the acute and chronic illnesses, build relationship with the Aboriginal Torres Strait Islander communities and health workers. Medium term expected outcome is that improve the community identification and intervention of the mental health disorders. Also, that treat people with the mental health condition to enable function in their community. Evidence of decrease in waiting times for the assessment and follow-up the appointments for 8 to 10 weeks to 2 weeks time diminished to 1 hour per week for this population. Long-term expected outcome is the reduced suicide rate, increase in general health and well-being, and early identification and intervention of the mental health symptoms. There are some other general expected outcomes is there. It definitely make the community healthier, community that responds effectively and efficiently due to the better understanding of mental illness. Relapse rate has a result of early intervention and a highly responsive service. Reduced admission rates, lower use of Mental Health Act 2016. Uh, Established nurse practitioner lead outcome clinic across mental health communities teams in the region. Number of consultation, education session with the client, family, non-governmental organization, general practitioner and other health professional with the positive feedback. Commencing the medical treatment and the commencement of medications in a timely manner. Development and implementation of mental health education session to the other mental health clinicians. These are the very good pie chart about the benefit of the nurse practitioner. You can definitely discuss about that part. It's the clinical benefits is that definitely it's improve access, increase choice, improve continuity, longer consult, case management, and the case coordination, enhance streamwork in a practice, offer of the new services to the patients. There is a economic benefits as there, opportunities for new revenue streams, cost effectiveness, remove unnecessary duplication of work, and there are other benefits that we need to consider as well. Patient satisfaction and health outcome, improved practice teamwork, shared patient encounter, addresses workforce issues and potential shortages, work-life balance for practice owners and the general practice team, better manages workflow. So these are the NP's mental health service benefits to the Central Highland public. Offer new service to the population identifier, assist in the closing the gap of Aboriginal people, improve access, increase choice, These are the I discussed previously in the pie chart. There are some other benefits that I already discussed. There is one, maybe this is the one. Be partner with a psychiatrist and have collaborative and triaging relationship. Provide high level consultation to other multidisciplinary team has appropriate, most likely for the time limited case management. Support the need assessment process, initiating review and support for the enhancing independence. Another very important part is nurse practitioner need to consider is cultural safety and cultural awareness, because Burubinda has the highest number of Aboriginal people, so we need to be aware about the culture. We need to understand about the culture. Uh, Nurse practitioner should have the culture competency, culture sensitivity, and also the culture humility as well. And we should not be biased about the different culture. And now, how to prevent? There are some prevention strategies for the Aboriginal people. Service that are affordable and acceptable to the young people. Counselors train and experience to the connect with the young people. Services that are easily accessible, particularly for the young people who lack parental support. Emergency responses that don't involve police and avoid hospitalization as much as possible. Now I like to discuss about the stakeholder consultation. Obviously, there are like three types of stakeholders: primary stakeholders, secondary stakeholder, and the tertiary. And also this other stakeholder is that interview process. So let's talk about the primary stakeholder for the project. Emerald Hospital and committee structure, because this position will be held in a Emerald Hospital, so definitely we need to involve the Emerald Hospital committee. Then another is one Central Queensland Hospital and Health Board, then CQHHS Board Safety and Quality Committee, Executive Management Sub Team, CQHHS Patient Safety and Quality and Risk Committee, CQHHS Mental Aort Service Committee, Emerald Safety Quality and Risk Committee, Central Highlands and Wurminda Incident Management Meetings, and the Emerald Mental Health Safety and Quality Risk Committee. The secondary stakeholders involves like the families, general practitioner, Oscar community service, Emerald neighborhood center, primary health networks, non-governmental organization like Center Care, Blue Care, psychologist, also community mental health staff working at the Emerald Hospital and Bilovilla Hospital. The tertiary stakeholder for the project involves that work actively in the community to promote case reviews and medication reviews for the client with the mental health issue. Support community service to provide to develop the necessary knowledge and skill to manage, support people with a dual diagnosis to live well in the community. And the last part is that one-to-one interviews with the stakeholder. Chief Nurse and Midwifery Officer, Principal Nurse, Sing Advisor, Senior Nursing Officer, Midwifery Officer, Clinical Nurse Consultant, Remote Nurse Practitioner in Central West, Queensland Nurses and Midwifery Unions Representative. Project partners. Definitely, this project can happen with the partnership with other members and stakeholders in the team. Worbinda Council and Elders, CQ Primary Health Network, Emerald Hospital and Mental Health Team, CQHHS Mental Health and Alcohol and Other Drugs Services, Advanced Indigenous Health Worker, and Darumbal Community Services. Definitely, we need to evaluate the project, because we need to know how the project has gone through and whether it's effective or non-effective or where we need to improve. So the project definitely has shown that 6 month after the 6 month review, it has reduced in the inpatient admissions in Rockhampton after the 12 months review, has reduced in the number of suicide rate and improved in mental health outcome. Definitely, we need to discuss about the risk management, because without risk management, how do you know how this your project is? Risk management, there are a few strategies that I need to discuss: securing the initial funding and recurrent funding, not being accepted in the Worbinda community, engage elders and stakeholders in early in the project conception, utilize Aboriginal Indigenous health worker for bridging the gap, cannot replace sick leave, annual leave, psychiatry register, could provide video conferencing clinic, need assistance from director of psychiatry, no clinics due to the flooding or other natural disaster, telehealth option would be mitigate this risk. The last part of this project presentation that I need to discuss on the budget. Budget is very important part as a part of the business plan. It's very important that you need to do how much the budget is required for to developing this nurse practitioner position in Central Highland. So these are the budget. So what does it feel like to be a nurse practitioner? It's very important. And these are my references. And this is any questions, any please do not hesitate. I'm happy to give the answer as well. And the last part is that feedback that I received from my stakeholder, because I submitted this PowerPoint presentation to the appropriate stakeholders within my team, to the Director of Medical Services, also the Emerald team manager, and I received a very positive feedback, and they are very happy for me to continue with this business plan and formalize the plan, and maybe next year they requested me to submit this plan for the approval for the position. So I'm very happy to listen to about this news, and hopefully everything goes well and I can submit it in my next year for this uh, business plan for to become a nurse practitioner in Central Highland, first time in the history. Thank you very much for your time for and listening to me. Thanks a lot.